Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Halothane hepatitis. Halothane hepatitis is seen in 1 in 30 to 35,000 patients. Mortality rate of halothane hepatitis is around 70%. The pathogenesis of halothane hepatitis is mainly immunological. Here, there is trifluoroacetic acid are seen. These trifluoroacetic acid is actually produces antigens, and this is antigenic. So it will activate the production of antibodies. Now there is antigen antibody reaction will cause liver damage leading to halothane hepatitis. So we should avoid frequent exposure in halothane hepatitis, and it is avoided in autoimmune diseases. In a known case of halothane hepatitis, inhalational agent of choice is sevoflurane because it does not produce trifluoroacetic acid.
There are two types of halothane hepatitis, type 1 and type 2. Type 1 is actually a self-limiting disorder, whereas type 2 is acute necrotizing hepatitis. So in type 1, it is seen 3 to 6 weeks post exposure of hepatitis, or post exposure to halothane, and in type 1, liver function tests are deranged. Whereas in acute necrotizing hepatitis, it is seen in 1 in 35 or 45,000 patients. Then the predisposing factors for halothane hepatitis include female sex, obese individuals, because halothane is maximum accumulated in obese individuals, middle age, pre-existing liver dysfunction, or if there is reuse of halothane within 3 to 6 months or less than 3 to 6 months of prior usage. So these are the important points. Summary. Halothane hepatitis. Halothane hepatitis occurs in 1 in 30,000 to 1 in 35,000 individuals, and the mortality rate is around 70%. It is immunological. So halothane will produce trifluoroacetic acids which are antigenic, and these will induce antibody production. So antigen antibody production is responsible for halothane hepatitis. So we should avoid frequent exposure of halothane less than 3. There should be at least 3-month interval should be there for giving halothane again. It should be avoided in autoimmune diseases, and if the patient has known case of halothane hepatitis, then we will have to treat the patient with sevoflurane, because sevoflurane does not produce trifluoroacetic acids. Then the halothane hepatitis is of two types. We have type 1 and type 2. In type 1 occurs, it is a self-limiting disorder, and it occurs after 3 to 6 weeks of post-exposure of halothane. And in type 1, liver function tests are deranged, whereas type 2 shows acute necrotizing hepatitis, and it is seen in 1 in 35,000 or 45,000 individuals. Predisposing factors of halothane hepatitis are female sex, obese patients, middle age, liver dysfunction, reuse of halothane within 3 to 6 months.
thank you and thank you for watching.